doctor in the loop.
Welcome back to the Morning Blend, where we keep chatting because this information is good stuff.
Yeah.
It is about a drug that taken in low dose will be big benefits for chronic conditions. And research shows it helps with rheumatoid arthritis, cancer, and even depression.
A lot of different things. And Omar Aliwa is a pharmacist, compounder, and the owner of Welltopia Pharmacy. He is here with more information on what's being called LDN Therapy, which is a low dose what? What's the medication?
Low dose Naltrexone.
Okay, so this is not a new thing. This
1963 when it was first designed in a lab. It was used since 1984. Approved for opioid addiction treatment, 1985.
For opioid addiction?
Yeah, at 50 milligram, 100 milligram for opioid addiction because it makes the addict doesn't feel the high of the drug. So it's given to the antagonist to shut down the receptor, the opioid receptor. And then Dr. Pahari in 1985 found that at very low dose, it mimics the effect of telling the body, I need more endorphins, which is the body natural, I would say, painkiller and happy kind of hormone. So we have a flood of endorphins, and also it works to decrease inflammation and help the autoimmune responses. And that way it is used to in terms of a supplemental therapy for many disease states that sometimes get to be overwhelming, and people ask, how come a drug can have so many uses?
Right. We were listing off all the different chronic illnesses, and I know that there are people listening right now that are going, okay, but I already take a host of medications. How is this going to blend with everything else that I'm taking?
It blends perfectly with many medications. Like we don't see drug interactions with a lot of drugs in the market. It doesn't have problem with blood thinners. The only thing is that if someone is taking opioids like oxycodone, Percocet, tramadol, there is a special dosing, what we call ultra low dose naltrexone, and it is a way to take naltrexone to help improve the outcomes of the analgesic effects of other drugs and lowering the dose if you're taking these harder drugs.
We're showing the book and some other things because I know you're always about educating the people who visit Welltopia, and people ask you so many questions, like me. And I love that you like to share information, that you thoroughly research things. So before we get to dosing, which I think is really important, and any side effects, really quick, we mentioned a few conditions that could benefit from LDN therapy. So they're Crohn's,
IBS, irritable bowel syndrome.
IBS.
Patients take several medications for this, and they get to need hope.
Cancer.
So cancer, it actually for colon cancer, ovarian cancer, pancreatic cancer, it's not a cure, but it offers patients many years to live with no progression of disease, and those patients with terminal illness that doctors say sometimes you have just few weeks and few months to live, and we see that patients are living much longer, and there is research and articles on this, and we understand that the doctor language is different from just telling stories. So that's why we have a provider folder and patient folder. So we discuss it with doctors. I invite doctors to the seminars to tell them how can this be actually effective for my patient, and I feel confident to prescribe it to my patient.
That was my first thing. It's like, why do the doctors not know? But again, like you said, it's about education.
It doesn't have the pharmaceutical backup because it's a compounded drug. So to have someone like a pharmacist going to talk to a doctor about it is different from having this kind of marketing behind other drugs.
But important to have an appointment, and I know people can do a consultation with you. You'll meet with people, you'll talk about the condition that they have. Here we're showing people how they can do that and schedule that to make a booking for that consultation. But I know you're happy to coordinate too with someone's doctor because you want to answer their questions, as well as making sure it's okay and that the doctor advises it. So talk a little bit about dosing and any possible side effects.
So there is a standard dosing that was used, like 3 milligram or 4.5 milligram, but then the success rate is not as good as a specific dosing, because now we have a lot of good data and information how to provide dosing for, let's say, Hashimoto thyroiditis. We start from 0.5 milligram, but other conditions we start from 1.5 milligram. So it's titrated dosing, start from like a small dose and then we go up, but when it's more specific, it's better. That's one way of saying it. The other thing is that the oral is not suitable for everybody, so we can do it as topical, as a cream.
Oh,
you know, we
that's
can do it as a
compounding.
suspension. So yeah, that's here that comes the compounding.
What are some of the success stories that you've seen with this?
So fibromyalgia, we see a lot of success stories with it. I have a patient with vulvodynia, a patient who was having, could not have sexual relationship with her husband for 10 years. And it was not studied for vulvodynia before, but the doctor decided to try it for her. And then she came back to the pharmacy. It's not my pharmacy, a friend's pharmacy. She came to the pharmacy in 2 weeks and she said, I'm now having the best days of my life. I'm having sexual relationship with my husband. 10 years. 10 years.
Wow.
She's been having problem. Vulvodynia, so neuropathic pain, okay, peripheral neuropathy, eczema, psoriasis.
Even depression.
And depression. There is a small study for depression, but it's, I think there is a Harvard article about it, but it helps also with depression, yes.
We ran out of time. I know that people are going to be really fascinated because it covers
Yeah.
so many different conditions, chronic pain, immune deficiency problems, lots of different things. You can get a consultation at Welltopia with Omar. An LDN consultation is just $45. We showed you how to book that. You can also call them for an appointment at 262-429-9429 or visit them online. It's welltopiarx.com. Learn more about LDN therapy. I know you always encourage people to be educated about the things that you talk about. Thank you so much.
Thank you so much.
Yeah.
Appreciate
Thank
your
you, Omar.
time.